Hello, everyone. I'm Arya from eGlobalDoctors, and welcome to today's FB Live session. In current times where the spread of virus brings restrictions on your physical hospital visits, would you believe that you can get consultation from 270 plus board certified experts from the comfort of your home? Well, eGlobalDoctors has made that possible. Through their website and application platforms, eGlobalDoctors is currently providing medical consultation with 30 plus specialties. Register today or download the app so you don't have to worry about you or your loved one's health concerns. Today, we have Dr. Umesh Sharma from Arizona, USA with us, answering questions related to general medicine and common COVID concerns. He's an internal medicine physician with 15 years of experience with focus on hospital-based care in collaboration with medical and surgical specialties as required. His interests being in perioperative medicine, CHF, and renal failure. He has residency in internal medicine from Vail Medical College of Cornell University of St. Barnabas Hospital, Bronx, New York. Welcome to today's FB Live session, Dr. Sharma. Thank you for joining.
Aya, thank you so much. It's definitely a pleasure being part of eGlobal and especially part of this live Facebook event. Thank you so much for the invite.
So tell us something about you, your background, clinical experience, and how you're associated with eGlobalDoctors.
Thank you. So, I've been in the US for almost 22 years. I've been a consultant for 15, almost 16 years now. And I got involved with eGlobal about 6 months ago with the pandemic hitting India pretty hard. And some of us had this opportunity to join eGlobal and then volunteer our time and efforts to really help a country, our country, my country, which was struggling and reeling with a COVID wave. And I think eGlobal is such a great platform that helped us connect doctors to patients and provide the counseling, the support that we can. So I stayed connected with eGlobal over the last 6 months. And now even with now the new Omicron variant coming up, there's always an opportunity to help out. So that's where I think eGlobal provides this platform to connect people who need help and people who can provide help at the same time. So I feel fortunate to be part of this effort.
Yeah, that's really impressive, Doctor. So speaking from a perspective of people coming from non-medical background, so what medical conditions are diagnosed and treated by internal medicine doctor?
So internal medicine in America is pretty much the general medicine. Back in India, the MD medicine. So usually what folks do is after medical school internship, India, they do 3 years of postgraduate medical training. Here it's after medical school is 4 years. They do 3 years here as well. So it's at least 3 years of postgraduate training. And you take the board exam, you get board certified. So we are typically the general medicine folks. So we deal with a lot of depth and breadth of general medicine, including preventive medicine, preventing infections, healthcare, maintaining health. And obviously, if you get sick, then people like me in the hospital will take care of you, whether you have, God forbid, heart attack, pneumonia, COPD, CHF, a stroke, what have you. We consult and provide care in coordination with surgical specialties and do perioperative care as well. So we pretty much do any medical condition from age 18 onwards. And so we, in America, we say we are the doctor's doctor. So when people need a in-depth consultation, we are the ones, we provide a comprehensive consultation for medical conditions.
Wow, that sounds like really tough job, but I really appreciate your efforts for the people. Also, there's one thing that always comes whenever you're looking for a medical doctor or many times on Google. So what is a hospitalist or hospital medicine physician?
Great question. So over the last 2 decades, 20 plus years in America in particular, things have got really complex. So in the past, you would have the same physician working in the clinic and next day work in the hospital and then work in the clinic again. So you could not be in 2 different places. So some folks decided why don't we specialize? People are getting complex. You cannot be in 2 different places at the same time. So if I have a sick patient in the hospital and I'm spending a couple hours there, my clinic patients are waiting. On the flip side, if I'm in the clinic with a busy patient load and somebody's crashing in the hospital, I cannot leave my patients go there. So we decided to separate the clinic duties from the hospital duties. And people like me decided to be inpatient specialist or hospitalist. So here, as I said earlier, if you get sick and be hospitalized, we'll take care of you in coordination with all the specialties. We are pretty much the quarterback of what happens in the hospital and provide that comprehensive care, dedicated care 24/7 around the clock. So people don't have to shuttle back and forth. we communicate with your clinic docs, specialties, and pretty much manage you in the hospital. When you're getting better, we send you back to your clinic docs. So that's pretty much the hospital medicine movement here is. I know back in India, it's still young. It's still like in the infancy. I know some programs have adapted this concept. So my hope is it starts expanding in the future in India as well.
Wow, that's great. So I would like to come to our today's main topic. There recently seems to be a lot of paranoia among people with this new Omicron COVID variant coming up. So I would like you to put some light on that. How easily does this variant spread?
So as we know, like 3 weeks ago, I think it's November 24th was in South Africa, they discovered this Omicron variant. So as you know, COVID is like any other virus, like flu virus, it mutates. It just tends to escape the available treatments and then just mutates by natural phenomena. And so there's really not a lot of good data yet. I would highly recommend the CDC website, the Center for Disease Control Atlanta, as a premier source for for information right now. One thing I would say, this is just like on a funny tangential basis, but try to get all your medical information from medical experts, not necessarily your politicians. Something to think about. Having said that, Omicron is a variant. It's we don't know if it's going to be more virulent than Delta, but seems like it's spreading rapidly. But from the anecdotal evidence and case reports and what's happening in South Africa and Europe, is people are getting sicker, but not necessarily to a point that they're getting hospitalized. So that's the hope. Also, it seems like the vaccines people have got, especially the boosters, if you got the boosters, there seems to be much more protection against this variant than if you did not get any vaccination. So at least in America, we know Delta has been the disease of the unvaccinated, especially the third surge. So I highly recommend get the vaccines. Here it's spreading. As of today, 25 out of 50 states have reported the Delta, the Omicron variant. So I don't know where things are going to go. But again, it's something, we are, cautiously optimistic it doesn't get as bad, but you never know. We have to just stay tuned.
So it seems like the best solution we have right now is to get double vaccinated as soon as possible. But there is a huge number of people who haven't had even one dose. So what would you do about the vaccine hesitancy? So what can be done to encourage the vaccinations?
So a couple of things is, one is, unfortunately, there are people who don't have access to vaccines and want vaccines. So I would highly recommend, try your best to get the vaccine through your local state departments, your medical schools, colleges, private clinics. That's one thing. The second problem is people who there's vaccine available and don't want to take the vaccine. For them, I would say, vaccines are like wearing seat belts in a car, right? The reason you wear a seat belt is that seat belts don't prevent accidents. But if you get into an accident, you're less likely to die because you're wearing a seat belt. Similarly, vaccines are not 100%, but if you have the vaccine, you're less likely to have a very severe infection and less likely to die or get complications. So people like me who are frontline staff, we deal with COVID day in, day out over the last couple of years. That's the best defense we have. Besides, social distancing, physical distancing, hand hygiene, wearing masks. And so I would highly recommend is, common sense measures, whatever our CDC recommends. Social distancing, be vigilant. Somebody's coughing, stay away 6 feet from them. If you get your vaccine, get your first dose, a second dose, a booster. And my suspicion is 3-4 months from now, we'll be getting a booster for the Omicron or some other variant as well. So that's our best chance. I would take it.
Right. You just simplified the term vaccination so good. It can be considered as wearing a seatbelt in a car. It's really simple to understand. So will the current diagnostic methods that we use to detect the COVID-19 or the treatments against COVID work same for the Omicron?
So as of now, I know scientists are working around the clock to determine, what are the best treatment based on the genetic makeup of Omicron. It's possible that some treatment may be less effective, but pretty much this is what we have right now. Regarding the testing, I did speak to one of my colleagues yesterday and asked him, like, hey, are those commercial available tests? Are those tests testing for Omicron? And what he said is most of the tests available in hospitals, they do detect this variant. And there's obviously, once those get to a centralized lab, they're doing those genetic testing. So I would say yes, the current tests do detect Omicron. Obviously, the governments are much more interested in knowing, do we have Omicron, more than the patients themselves. So yes, the answer is yes for that.
Great. So they can be detected and treated the same where the previous variants were.
Right.
So are the symptoms any different from the previous variant?
Currently, it's unclear if this Omicron symptoms are different than what we have, but obviously if you have fever, chills, myalgias, cough, runny nose, loss of smell, taste, diarrhea, joint pains, you definitely want to get tested for COVID, tested for flu, influenza. And again, once you get tested, they'll know if you have Omicron or not. And so any symptoms have a really low threshold to get tested. Again, time will say that obviously I would look out for CDC website and other reliable websites for the symptoms variation. But as of now, the data out there is still coming, and hopefully in next week or two, we'll have much more idea on how Omicron presents itself, what's the best treatment, the efficacy of vaccines, or even the monoclonal antibodies and stuff like that. So there'll be more data coming out. I would say stay tuned.
Right. So people are continuously watching the news and they are worried with the cases rising with this COVID variant again. And of course, everyone is concerned and stressed out. So how would you suggest to cope up with this COVID-19 mental stress coming up?
Great question. So, one thing I will say that us with COVID, and I'm sure you guys have realized by now, this is not a 100-meter dash. It's more like a marathon, right? COVID is here to stay. I hope it doesn't stay too long, but the fact that it's still lingering around after almost 2 years, close to 2 years, it's here to stay for a while until we have a reliable vaccine or treatment, or the virus just goes away. So having said that, it's really, really crucial to stay not only physically fit, but also mentally fit in these times. And I would say focus on the positive, do common sense stuff like vaccines, masking, hand hygiene, try to connect with folks either virtually or in person. So those are the way you would want to stay, mentally, physically fit. In fact, I coined a term called professional, professional, professional. We all are professionals, right? Whether you could be a stay-at-home mom, but you're a professional mom, that's your profession in a way. You're a physician, you are working healthcare, you're working non-healthcare, we're all professionals. So we need to stay physically and mentally healthy. So the P in professional is perception of reality change. We all know our thoughts create a behavior, and a behavior creates actions. So happiness is inside you, not outside. So that's something to figure out is how can I be happy? What makes me happy? R is responsible prioritization. We cannot boil the ocean. Try to figure out what are those top 2-3 things that's important for you and reprioritize your priorities. Then others, always for others. One of the quickest way of feeling happy is helping others. Try to help others, volunteer, choose causes that are close to your heart. F is forgive yourself. Don't try to be hard on yourself. It's been tough for everybody. Have some grace. You've hung out there. You've done your best. Have some, grace for yourself and forgive yourself and others. E is exercise, whether it's yoga, meditation, what have you. Exercise something daily, walking. S is socialize, as I said earlier, socialize in person or virtually safely. And another S is seek help. There's always a point where some people may feel so low that you might be depressed. There's no harm in seeking help, whether it's professional or personal. Talk to somebody. I is innovate yourself. Try to do something new every year. Try to find something that's of passion for you, whether it's a new hobby or sport. Always for outdoor therapy. Connect with nature, and more importantly, disconnect from social media. Obviously not right now when you're watching me, but afterwards, disconnect from social media. Then N is negative to positive. Practice positive self-talk. We tend to focus on the negatives that happen, but there are so many millions of positives that happen every day. Try to focus on those couple, 3 positives that happen. A is assess progress towards your goals. Set some easy, achievable goals and monitor progress towards those goals. And less is more. Try to eat healthy, eat in moderation. Try to eat vegetarian. So basically, these are some of the tips I personally use and have been using over the last year or two to stay physically and mentally fit.
Wow, that term you coined is really good. That's professional, right? So
right, professional.
Great. So the vaccination and hygiene is the only good option we can do right now to be sound and healthy physically as well as mentally. That's
absolutely right. So as I said, that's one thing I figured out is like, what can I control, right? There's some things I cannot control. I cannot control whether it's going to be a Delta or Omicron or Epsilon or Mu. What I can control is can I get the vaccine? Yes. Can I mask? Yes. Can I wash my hands? Absolutely. Can I eat healthy? Yes. Can I exercise? Yes. So those things you and I can control. We should absolutely be doing it. Those things we can influence, like our neighbors, our friends, we can influence them to get the vaccine, to stay healthy and mask. But we should absolutely do it. The stuff we cannot control is the evolution of Delta and all these viruses. So be it. We just have to, as I said, it's a marathon. We have to just find a way to live with it.
Correct. Thank you so much for providing so valuable information. People are definitely going to be benefited by this, listening to this. And thank you so much for your time. And I am going to wrap up the FB Live.
Absolutely, Arya. Thank you. It's my pleasure. And again, I think eGlobal is doing a phenomenal job of being that platform to connect, patients and health seekers to health providers. So again, I want to congratulate eGlobal for this great initiative, and thank you for this opportunity. Have a good day.
Thank you so much.
Thank you.